Welcome back, everyone. You know, many people fear the dentist's office, but not to worry. General dentistry can be done under the comfort of anesthesia. And here to talk about dental anesthesia for young patients is Dr. Chahal with the Central California Dental Surgery Center. Welcome to the show, doctor. It's good to see you. Let's talk about baby teeth for right now, because a lot of people ask, why is it so important for us to take care of the baby teeth if they're going to eventually fall out?
Baby teeth are actually very important for growth and development of the permanent teeth that we eventually get. And they are actually the pathways for the development of the adult teeth, and for proper confident smiles and, you know, eating food in a clean mouth is very important for young kids.
Yes. So we should start brushing the gums, obviously, when they're babies, and then brushing their teeth as soon as they start popping out.
Yes, exactly. That is.
At what age do you think we need to start taking them to the dentist?
Whenever it feels right, actually. By the first birthday is the right time to start seeing a dentist. And there should be a dental home for a patient by their second birthday.
And what is expected at a routine dental visit with you?
In our Central California Dental Surgery Center, we do kids under general anesthesia. And in our routine visit, we try to do everything at one time. Patients are sleeping, we do exam, x-rays, cleaning, need be all the treatments that need to be done, or dental sealants. We can do all that in one visit.
Well, that's really great, because we all know how kids can get in a dentist chair. I mean, it's difficult for us to sit in a dentist chair and have a procedure done, but for children, it's even harder. So this is a very safe way to do things.
It is perfectly safe. There is no problems with general anesthesia.
And you mentioned dental sealants. Let's talk a little bit about that. And at what age would a child need dental sealants, and what exactly are they?
Dental sealants are, it's a shaded plastic material that we put on the biting surfaces of the teeth that have deep pits, fissures, and grooves that can easily catch cavities. And this is actually to seal off any plaque and basically to make the tooth smooth for brushing.
Oh, is this before or after a cavity?
Before a cavity is formed. So it can prevent the cavity.
Oh, I see.
Yeah, it's a preventative measure.
Okay, do you see a lot of kids with cavities nowadays?
Yes. Actually.
All right, let's talk about why a child would need a filling or a silver star. What exactly is that?
Silver star is actually another word we use for a filling.
Okay.
And filling is needed once there is a decay, a cavity is, we clean up that decay and it has to be filled with the material. And if it is filled up with amalgamated material of silver, tin, and mercury, we call that a silver star.
Oh, that's why we see the kids with okay, I see. Okay, and that's kind of protecting their kids and
actually that is, no, it's not protecting. It is actually a treatment procedure, because once the cavity is formed, we have to clean up the cavity and fill it up with this.
Is it true that babies get root canals?
Yes, they do.
Wow. Okay, let's talk about that a little bit.
They are called baby root canals, or pulpotomies in a medical term. And baby root canal is actually when the decay or the cavity gets deep enough to the nerve of the tooth. We have to clean up the nerve. Actually, only the top part of the nerve is cleaned. It is sterilized and then sealed. That is called a baby root canal.
Wow. Okay, and that's pretty amazing.
It's not actually a root canal like adult teeth. It's a smaller procedure than an actual root canal.
And what about crowns?
Crowns are done after the tooth is cleaned and sealed with, after the baby root canal. We have to restore it with a crown. And the crown is something we put as a cap on that particular tooth.
Wow. And spacer crowns?
Spacer crowns are when the cavity gets deep enough that it becomes an abscess. Abscess is infection, and we have to, you know, unfortunately lose that tooth. And to maintain that space where the tooth is lost before time, we have to put a spacer crown in between that.
Well, so all these procedures on young children do happen quite often, I imagine. How often should children be coming back? And do you refer the children back to their dentist? How does that all work over at the center with you?
We get referrals from the dentist where the kids are not cooperative or they are too young to properly sit in the chair. And after the procedure is done, we take care of everything. We refer them, we prefer that they go back to their original dentist, but if they're still uncooperative over there, we can still see them every year. Actually, if they are cooperative in a regular dental office, every 6 months would be a great time but under general anesthesia, we prefer every year.
All right, sounds
Yes.
good. Well, it's good to know that there's a place out there that can be done where it's safe and they don't
Yes,
feel
exactly.
a thing. All right,
No.
Central California Dental Surgery Center. You can visit them online at sleepydent.org or give them a call if you have any questions at 209-381-2047. Doctor, thank you so much. Great information for parents
Thank
out there.
you.
Appreciate it. All right, stick around, everyone. Central Valley Today. We'll be right back.
Thank you. How was it?
Oh,
Good?
great.
Okay.
It was